afternoon. I'm Michaela Muller with the Tuesday edition of the Our City COVID-19 News Show. We will be updating you on the latest information and resources around the COVID-19 pandemic while unpacking the deeper issues as they emerge. Today we will show you some of the highlights from a press briefing from Dr. Blade Nzimande, who announced on Sunday the results of the survey conducted by the Human Science Research Council. The research covered the impact and awareness of the coronavirus among South Africa. Later we will find out about the effects of the lockdown, small-scale farmers. Stay tuned for that and more. We encourage you to get in touch with us. We want to hear from you as we welcome contributions from movements, healthcare providers and our audience. We want this program to be a two-way flow of information, so please get in touch with us. And now for the news. It is day 32 of the national lockdown, and currently the number of confirmed COVID-19 cases stands at 4,793 with 1,473 recoveries and 90 deaths. The number of COVID-19 infections are increasing at Cape Town's police station. Lendegeer police station remains closed for 48 hours for decontamination after a case was confirmed yesterday. Two other police stations, Philippi East and Cape Town Central, were closed this weekend after COVID-19 cases were reported but could reopen today. Health Minister Zweli Mkhize briefed the Portfolio Committee on health via a Zoom meeting on Monday. He said patterns of infection differed from province to province. Earlier on, we spoke to Dr. Zivunkhizeni Dlomo, chairperson of the Portfolio Committee on Health, about the latest on the COVID-19 front.
Because we raised that matter, and then the minister also did not expand much on it, because I'm sure he was also waiting for more information. But my colleagues who are members of parliament and across all political parties who reside in the Western Cape had some more information on this matter. But let's just start by saying, let us adhere to the lockdown protocol regulations. You know, last week, Minister Nkosi Zuma gave an advice and a warning to say, please, all of us, even in the enterprise, in the food chain industry, let us not take shortcuts, because it might even cost you more. Because if it means you have to close that section and you ignore that, and by the time there's an intervention that comes to you, you then have to close down the whole plant. Now, you just observe, if you actually pick up that there's one infected or affected a worker, that needs to be attended to, including those who are close to that chain of work within that space. And we are not saying at this time close the entire plant. But if you don't observe that, and maybe that worker now goes home, interacts with other staff members in other sections, then you'll be forced to close down the whole plant. It has happened in other hospitals, in other food chain industries. So we are actually giving that advice. I would not have those details in regards to this particular food chain processing plant, but it was bordering on them having to be told to say you shall do this. Because all we are saying, if there is one of your workers who has tested COVID-19 positive, give it a benefit of doubt that all those who are closest to that person could be infected too. Get them out of that scenario, get them tested, get them quarantined, and then we observe that period where we could then say there are no more testing positive, or they are not testing positive, and move on. But if you ignore that part of saying this person is a potential contact of COVID-19, then we are not able, and the rationale of doing this is to lock down these staff members into a dead end, move them to be there and not come up into a bigger space. That is the rationale of locking down and creating a dead end for any other worker you pick up to be COVID-19 positive.
Dr. Dlomo also touched on citizens adhering to level 4 regulations, which are coming into effect on Friday, as the number of COVID-19 cases are still increasing.
Look, we would still have to hear the unpacking of level 4. If it's going to come with, among other things, get out of your house, wear a mask all the time, then you are already, from what you hear, decreasing chances of me sneezing and coughing into an open space or you sneezing into me. So in that way, whether you are COVID-19 positive or not, we will be able to contain your saliva splashing into my face the whole day long. This is something that is already being advocated. You want to get out of the house, wear a mask, whether you're going to the supermarket or probably now we are going to hear when people get to the place of work. And therefore, and the government is very clear on some of these issues, it will not provide a mask for all South Africans traveling the whole country, but it is an expectation that employers should make those masks available to their employees. Again, if you are to welcome level 4, it means, among other things, you must be ready and willing as an employer to provide the workers with the mask and assist them to get them, because otherwise, the whole day long, they must be in your factory. Some of them who can be able to work from home should do so, but for those that are probably in this workplace, creating social distance with a mask on, we are likely not to really see an increasing. But of course, I can't be a foreteller. It's only when we adhere to these protocols and not violate them, as I'm pointing out, that are being violated in some other areas, and the people are not really adhering to them.
Police are investigating a case of assault after a video in which a farmer is seen assaulting a man on his property went viral. In the video, the farmer repeatedly slaps and punches the man in the face after accusing him of stealing apples. The victim has denied this, saying the property was surrounded by electric fence. Rural and Farm Workers Development Organization Executive Director Billy Claassen said the incident was unacceptable and lodged a criminal complaint. The Western Cape has now been declared the epicenter of the deadly coronavirus. Outbreak among essential workers have led to the Western Cape overtaking Gauteng, while funerals and an outbreak in the correctional service system drove up Eastern Cape figures. This is according to the Health Minister, Dr. Zweli Mkhize, who had a virtual meeting with the Parliamentary Portfolio Committee on Health and the Select Committee on Health and Social Services earlier this week. Mkhize said this was concerned and that the Eastern Cape had overtaken the Free State, where the pattern was based on the incident, a large church gathering where many people were infected. Families of pupils attending Crystal House were overjoyed after the learning institution set up an e-wallet system which provides money for pupils from destitute families to buy essentials. Many children at the schools came from poor homes that only receive a social grant to meet their basic needs. The school spokesperson, Megan Sonnenberg, said Crystal House usually gave pupils 2 meals a day. She said it was their duty to help struggling families. Pupils also began to remote learning, while teachers liaising with parents over WhatsApp to assist learners in completing their workbooks. It's now time for an ad break. We'll be back shortly. Welcome back. You're still watching the Our City COVID-19 show with me, Michaela Miller. We will be giving you the latest updates of the COVID-19 pandemic and sharing essential resources and information with you. Higher Education, Science and Technology Minister Dr. Blade Nzimande has announced the results of the survey conducted by the Human Science Research Council. It covered the impact and awareness of the coronavirus among South Africans. The first wave of research took place between the 27th and the 31st of March, while the second was conducted from the 9th to the 16th of April. The aim was to mine data will lead to context-specific health and well-being frameworks required to address individual, family, community and society at large. It covers primary prevention, early detection and patient care levels, as well as long-term mitigation of the impact of the pandemic.
We felt it is important to give this background information. Of course, everyone knows that communities are at the heart of any disease outbreak and health emergency response. With the deep inequalities and poverty that we face as a nation, flattening the curve through social distancing and enhanced practices will only be successful if we understand key social and behavioral factors that make this difficult. The work that will be presented here today is based on social science research and analysis, and it's led by our Human Sciences Research Council, which is one of the entities that reports to my Department of Science and Innovation. And I would like upfront to thank all the partners who were part of this research, as well as the participants themselves. The team will explain, once they take over, how they did this research, but what I want to say is that the research represents a survey that was undertaken between the 7th of April and the 14th of April and looked specifically at the lockdown as implemented by the President from the 27th of March. But before we can present the outcome of our research, we think that it is important to understand this research as part of a whole lot of other interventions that are being made by the Department of Science and Innovation as part of the fight against COVID-19.
So today, we have the pleasure of discussing our preliminary results from the lockdown survey. The data has been captured between the 8th and the 24th of April. So what are we looking at here? We're looking at moving from a lockdown to community participation, community motivation, and enablement. So the first slide is indicating the demographic profile by race, sex, and age, and here we see that 70% of the 19,330 participants were between the ages of 25 and 59. We've broken down the age groups in this manner because this shows us who's susceptible to infection and who's not, and how the infection plays out in the different age groups. We also see that we have slightly more females than males in this survey, with females representing 52%. This is a demographic profile by employment. Importantly, in this slide, we see that 36% of the participants are unemployed, 10% had informal or part-time work, and 9% were self-employed. The profile by province, we see that the majority of the participants come from Gauteng, 28%, KwaZulu-Natal, 18.3%, and the Western Cape, 12.4%, with the Northern Cape being 2.1%. In terms of community type, we see that 35.1% were reported as township dwellers, and 20% reported themselves as rural dwellers. The slide on knowledge about COVID is very interesting, and we've measured knowledge using several items. So we see that the knowledge between staying 2 meters away from another person wearing a mask correctly, staying away from people who are infected, not touching your nose, face, or eyes, and washing your hands frequently for 20 seconds varies between 97% and 85%. So this knowledge is very high, which is suggestive that all the health education interventions that we've seen on the television by the President, by the Minister of Health, and other important people has made some dent in knowledge. So we are here with a very high knowledge situation. However, in the next slide, we examine risk perception. And what we see is that the majority of people perceive themselves as low risk, with the second amount perceiving themselves at moderate risk. So we're looking at 46% and 32% respectively there. So what are these two data sets telling us? What does the findings actually tell us? What it's saying is that being in a situation of lockdown could have given the 1 in 2 people a sense of security, so they perceive themselves at low risk. 1 in 5 people believe that they are at high risk for infection. So how do we move this data to action? If the burden of disease is high and generalized, the mortality is high. Most people will perceive themselves to be at high risk. But when the curve is flattened and the burden of disease appears to be relatively low and the mortality low, then most people will perceive themselves to be at low risk. This complacency could be due to the success of the lockdown. We may become victims of the successes gained during the lockdown if preventive behaviors are not intensified as we move forward into this epidemic. So what is the health promotion strategy here? The strategy is both behavior change and one of policy. As we lift the lockdown, preventive behavior change has to be intensified. All people of South Africa need to take responsibility for their own behavior. Targeted messages have to promote voluntary behavior actions such as hand washing, social distancing, and the wearing of masks. The tipping point between the economic, epidemiologic, and social and individual behavior is on the line here. The next slide demonstrates staying at home by age and community type during the lockdown. What we see here is 30% reported that they had not left their home since the start of the lockdown, and 62% indicated that they had left their home to get food and medicine during the lockdown. What are these findings telling us? The majority of people adhered to the lockdown. The results show that 99% either left their homes for food, medicine, or social grants, and the rest of them stayed at home. This is compliance. From data to action. This is important to build upon. The country needs to move from a situation of lockdown to appealing to the community for participation and invoking a spirit of Ubuntu. What is the strategy here? The message is for South Africa, you can do this to save lives. Take control of your lives to prevent you, your family, and your neighbors from contracting this lethal virus.
To find out about the effects of the lockdown on small-scale farmers, Helga Jansen Douwberg spoke to Ashley Newell, the co-founder of Food Flow, an initiative launched just 4 weeks ago in Cape Town. It uses donor funding to buy produce from small-scale farmers and food products and delivers it to communities' organizations for distributions to those experiencing food insecurities during the COVID-19 lockdown.
Good morning. I'm here with Ashley Newell. Ashley has a very interesting story, and it revolves around food security. Ashley, we know we're going to be interviewing your dog as well, because I hear her barking in the background. But yeah, we will continue. Ashley, the issue of food security has been the uppermost imperative of many communities, not only in Cape Town, but across the country. Food Flow has come up with a unique initiative. Tell us about this initiative.
So Food Flow uses donor funding to purchase directly from small-scale farmers and food producers and redirects that food directly into communities experiencing increased food insecurity right now.
Okay, so how did it start? Where did it start? Yeah, tell us about that. And how does it work?
Yeah, so a few weeks before lockdown was announced, my co-founder, Iming Lin, is a farmer herself here in Cape Town, and she realized that many of her restaurant clients were having to shut down, and recognized that many farmers would be in the same position, and had the idea of purchasing from those farmers and acknowledging that at the same time the schools had closed, school feeding schemes were closed. So just kind of shifting the flow of where food was going from farmers directly into communities that were relying on those meals provided by those schools. So that's how we started. And within a matter of days, lockdown was announced, which of course has exacerbated the challenge, tenfold. And so so now we've been partnering with a number of farmers and getting their food into a number of communities across the Cape Metropole and Winelands areas, and now also with some partners in the Eastern Cape, KZN, and Limpopo.
So, it sounds absolutely amazing. I just want to confirm, these, of course, are small scale and subsistence farmers. These are not the big commercial guys.
Yeah, so we're really focusing on food livelihood. So the individuals that directly rely on, farming, maintaining their families through that income. So those that aren't a part of the large retail supply chain at the moment. So these are farmers that have been selling to restaurants, to hotels, to small farmers markets. And have now lost those clients. Even the informal vendors, even though they're allowed to sell, they've lost a lot of their foot traffic of people not coming and going to work. And so they're also not purchasing from the farmers at the moment.
So as you say, it is about redirecting the flow of food directly almost into the homes of communities. So I want to ask again, how can Cape Townians or people across the country who are watching this, how can they get involved in supporting the food flow?
So you can sponsor a harvest box for 128 Rand, and that goes directly into making a purchase from the farmers. We've now spent, as of this week, over 500,000 Rand directly to farmers to purchase their food, and then that food is delivered to community organizations that distribute it to those in need.
Do you have an idea of exactly how many community organizations are benefiting from this?
So we've partnered with over 20 community organizations delivering into more than 25 different communities at the moment. Of course, the demand is huge. We're hearing from many organizations, many new soup kitchens are being established that would love to also source from these small scale farmers. So at the moment, we're really trying to reach out and make sure that we're connecting with those that are in need of a market right now to make sure that we're getting food to really where it's really needed.
So you mentioned that it started out in the Cape Metropole, but you've expanded. Just remind us again and tell us again of where you've expanded to. And I must just remind our viewers, this is not a long-term project. It is less than 2 months old.
Yeah, so we just over a month old now, and so we're working largely here in the Western Cape, but we have a group of farmers in the Eastern Cape that's across 4 villages that grow sweet potatoes and madumbis, and so we've now purchased their harvest every week to be delivered across a number of other villages and townships in the South Coast. And we've also partnered with an amazing farmer and entrepreneur in Durban who has a great partnership with a local organization there that she's supporting. And now also working with a small group of farmers in a village in Limpopo that are kind of circling around one community organization to get food to a number of families there every week now.
Ashley, let's just talk post-COVID, well, post-level 5. Okay, let's imagine in
Yeah.
July, August, you're now at level 3.
Yeah.
What could be, because this is an amazing initiative that satisfies supply, satisfies demand. There are some business principles that work, but it has a heart. So just imagine and dream how this could really disrupt the flow of food.
Yeah.
Tell us what your thoughts are.
Yeah, so we're trying to strike a balance between really being a stopgap solution in that we do want our farming partners to be able to, as soon as possible, go back to business as new normal and reconnect with their previous clients. But we also recognize that there is a role for these small scale producers to be a part of these supply chains, to tap into community organizations that are really trying to feed their community, and also shortening the supply chain, making sure that these farmers have an economically sustainable way to really provide food to their neighbors, to their communities.
Yeah. Ashley, just give us some contact details of how people who want to support Food Flow can get involved. I see from your website, and you're going to give us those details in a moment, that ordinary people can actually purchase what you're calling a harvest box.
Yes. Yes. So through sponsorship of harvest boxes, that is how we get the food out to those that need it right now. So that's the best way to assist. And our website is foodflowza.com. And we're on, you can see all the weekly updates of the deliveries and the farmers that we're working with on social media at foodflowza. And you can purchase the harvest boxes through web tickets, as well as through direct EFT on our website with our partnership with Oxfam South Africa.
Okay, I wish you and your partners and all your distributors across the country, because clearly it's going to grow. I wish you all the
We are taking a short break. When we come back, Octavian Glovo will update us on the latest social media.
Welcome back. Before the ad break, we had Michaela Miller with the latest news. In order for us to win the fight against the COVID-19 pandemic, we need to stay at home, adhere to lockdown regulations, and ensure that we wash our hands regularly. We must also wear a mask while in public and maintain a safe physical distance of about 1.5 meters at all times. So far, the COVID-19 pandemic has killed over 200,000 people, and here at home, Cape Town is now the epicenter of COVID-19 in South Africa. And now for social media. Share your thoughts with us on Facebook, we are Our City CT, and on Twitter at Our City CT. This is a time we need to come together as a nation. These are the public hashtags on Twitter today. Orania, the white and Afrikaner-only town in the Northern Cape, is feeling the economic effects of the coronavirus. Meanwhile, Twitter is getting to grips with the fact that it has its own money and flag. Orania must fall, many are saying. Lesotho. While snow fell on our neighboring country over the weekend, but it hasn't whipped out the Mountain Kingdom's problems, with its Prime Minister Thomas Thabane refusing to resign after allegedly being linked to the murder of his ex-wife, Lepelo. After the ad break, we'll be crossing over to Michaela Miller, who will share information on resources and places of safety that you can use during this period. Stay with us.
Welcome back. You're still tuned into Our City, the COVID show with me, Michaela Miller. Before the ad break, Octavian Glover looked at what has the nation buzzing on social media platforms. For your latest news around the COVID-19 pandemic and to see what other Cape Townians are doing to keep safe, tune in to Cape Town TV Daily. These are some organizations helping communities stay safe during this period. That's all we have for you today, but if you have something to say, we want to hear from you. Send your comments, news and questions to us via Facebook at Our City CT, on Twitter at Our City CT, or get in touch with us via our email on ourcity@capetowntv.org. This is a time that we need to come together as a nation, so if you're not sure about something, send us your questions and we'll try to find the answers for you. You can also call us on 021 448 0448. From me, Michaela Miller and Octavian Glover, goodbye.